Johan Warner, age 52, president of the American Heart Association, just had a heart attack. We'll talk about it in just a minute, but first a brief introduction. Dr. Ford Brewer, PrevMed, heart attack, stroke, cancer, disability prevention. Dr. Warner, Johan Warner, was 52 years old, or still is. He survived it. It was a fairly minor heart attack. He's a physician and a practicing cardiologist, an interventional cardiologist, the kind of cardiologist that sees people when they have a heart attack and puts a stent in. He's also the CEO of the University of Texas Southwestern Hospitals. He's president of the American Heart Association, and he was at an American Heart Association event in Anaheim. He gave a speech about his own family history. Father and both grandfathers had had heart attacks. And here was his quote, a couple of quotes from him. "There are no old men on either side of my family. I know this is true." This was before he had his heart attack, just before he had it, by the way. "I know this is true of far too many families, not only in the U.S., but throughout the world. Together, we can make sure old men and women are regular family members, are regulars at family reunions. I look forward to the future. There's much remaining to be done." And I would agree. Again, his specialty, the interventional cardiologists, have done a lot of great work. However, we still seem to be lagging behind in terms of taking information that's known about prevention and preventing this in the first place. And I can assure you, any of the treatments after the heart attacks have occurred, like stents and other things, bypasses, all of the procedural things hurt. And they're far less desirable than prevention. Here's one of the things that we're lagging behind on. UCLA, the University of California in Los Angeles, just published a study recently. You can find it on the internet, and I'll do another video about it specifically, where they're saying the majority of adults in California now have insulin resistance, if not full-blown diabetes. That is the number one, at least known cause of the inflammation that leads to heart attack and stroke. Yet, the vast majority of people that have insulin resistance, metabolic syndrome, prediabetes, don't know it. Those that are concerned and smart enough to look for it often go to their doc. The doc looks at usually just a fasting glucose or a hemoglobin A1C and says, if those might be normal, you're fine. Well, just as to go back and make a point, this study, which showed over half of Californian adults having insulin resistance, that was based on only fasting blood glucose and hemoglobin A1C. So when you start looking at oral glucose tolerance tests, you get a much bigger number. And when you start looking at things like an insulin survey on a patient, you get even a far bigger number. So we are way underreporting and underdiagnosing insulin resistance. There are other things too that we're not even looking for, like Lp(a). And yet we continue to focus on LDL. So again, in many ways, we're way behind in terms of prevention. Inflammation is a huge issue. This is Paul Ridker. He's a cardiologist. He's been preaching this gospel of looking for inflammation for over 20 years. He's at Harvard, Brigham and Women's, and he just published again on a study called CANTOS. I've done another video on that. They took a major anti-inflammatory drug and gave it to people all over the world, and it greatly decreased heart attack and stroke. Now, that anti-inflammatory drug is not going to be used immediately for heart attack and stroke prevention. as many people as it saved by preventing heart attack and stroke, it ended up causing increased serious infections, which you expect with that type of anti-inflammatory. But it's very telling to look at the YouTubes and the other reactions, spontaneous reactions of cardiologists and trendsetters and folks like Dr. Warner, who are in leadership positions on cardiology and prevention. The recurring theme you hear from these folks that are setting policy is, I didn't know that. Inflammation is the new thing we can go for. Steve Nissen, one of the cardiologists that's, again, a leader in research, has now said, based on the CANTOS study, we've got a whole new field we can start looking for prevention for heart attacks and strokes. It's called inflammation. Again, many of us have been looking at this for decades. Brad Bale, Amy Doneen wrote a book about it. It's called Beat the Heart Attack Gene. They didn't create that science. One of the major, they've done a lot of good work in the area. They've made major contributions, not only in the science, but in education and training for docs and dentists and other healthcare providers to understand this issue. Again, Paul Ridker, as I mentioned before, is one of the foremost researchers in this area. You can see studies like WASCOPS, the West of Scotland study, Jupiter trials, that looked at inflammation as opposed to LDL, which has been our go-to preventive concern in the medical community. So, what do you think? Did you know about this before? Do you have comments? Are you interested in preventing your heart attack and stroke? For those who are interested, please see the information below. Unlike most doctors, we actually provide a money-back guarantee for our work. Thank you again for your interest. Bye-bye.